Welcome back. Today I have Dr. Tang and Dr. Sharma, who are here from MemorialCare Saddleback Medical Center. And today we are going to discuss the treatment of abdominal aortic aneurysm. Now that's quite a mouthful, and obviously something that is super important for us to be talking to our viewers. So tell me a little bit about, first we'll start with Dr. Tang. Tell me a little bit about your background.
Well, thank you. My name is Wang Tang. I'm a vascular and endovascular surgeon. I practice here at Saddleback. I've been taking care of this community here for 13 years.
All right.
And I have a specialty in vascular surgery and endovascular surgery, which is something we'll talk about today, which is managing surgical problems through minimally invasive techniques.
Okay.
Yeah.
All right. Great.
Yeah.
Great. And you started where?
I came here straight out of fellowship.
Oh, okay.
Yeah, I trained 15 years at University of California, Irvine. I did my fellowship at the University of Utah and then came here. I'm the chairman of the board for the surgical center across the street at Saddleback.
Okay.
And I'm also the medical director for peripheral vascular services at Saddleback Hospital.
Okay. Excellent. All right. How about you?
Did my general surgery at Michigan State in Flint.
Okay, great.
So again, same strong interest in aortic surgery and all things vascular.
Okay. Excellent. Well, let's get kind of right into it. So tell me a little bit about what abdominal aortic aneurysm is. I mean, what actually causes it and what it is.
Sure. So abdominal aortic aneurysms are a dilation of the aorta, and for the ones that we're specifically talking about below the kidneys, as exemplified in this picture, these would be the kidney blood vessels, and this would be the dilation below.
Okay.
So technically, anyone who has a dilation of 3 centimeters or bigger is technically an aneurysm.
I see. So
these patients, a lot of times they're found incidentally. They have other scans or ultrasounds that find these. But typically the things that would put these patients at risk are being male, gender, men over 65 who have been smokers at any time in their life should be looked at. And also just familial or hereditary factors also.
Okay. All right. And is there some, like, what are some of the symptoms that you would you feel anything?
So typically, these do not cause any symptoms. Usually at the point at which they do, it becomes an emergency for us. So it would have to be large enough or enlarging rapidly enough that it would cause pain for the patient. And that would be a sign to us as surgeons that it may be an emergency and maybe at risk for rupture.
Okay.
The other concerns would be if these things are large enough that they would compress their surrounding structures, but that's pretty rare.
Wow. Okay. All right. And then now you already told us about who is at risk. What are some of the treatments that we could be looking at for something like this?
So this is your body's aorta, and this sits in the middle of your abdomen here. This artery is normally the size of a garden hose. And these are the arteries that branch off and go to each kidney on both sides, as Dr. Sharma talked about.
Okay.
This is the aneurysm itself. It's dilated, and this segment here is the abnormal portion. The artery then divides and goes down to your legs. We can access these arteries through what we call endovascular techniques. And what we're talking about today is a minimally invasive way to fix these aneurysms. It's the standard of care to fix aneurysms, and it has been for the last 15 to 20 years.
Okay.
And the way we do these is we reline this weakened area. The risk of this having an aneurysm is it enlarges and it ruptures. And if this aneurysm ruptures, most people die immediately.
Oh my.
Right. And so, and again, these are asymptomatic most of the time. And so oftentimes the first time you'll know about an aneurysm is its impending rupture, impending death. So today we fix these aneurysms. We have an ability to put stents inside these aneurysms.
Right.
Stents are fabric-lined tubes that are supported by metal struts and are compressed down onto something the size of our pen.
Okay.
And that device is then placed through an operation, through arteries down below, and then this device is then placed inside the artery itself, relining the inside of the artery, redirecting flow through the stent and depressurizing this aneurysm itself.
Okay. Okay.
These are modular devices. They're different sizes. They're custom sized. There's different lengths. There are different components that can be placed together.
Okay.
And can be extended into both arteries. And there's different configurations of all these, custom fit to somebody's anatomy.
Okay. And then how do you actually insert this? Is it through a needle, or is it going through an artery? I don't know.
Yeah.
How do you do it?
Yeah, it's pretty impressive. These are all done through percutaneous approaches today.
Okay.
So percutaneous approach is basically large punctures through your groin into your femoral arteries. You know, the arteries down below here,
Right.
in your groins, on both sides, and these are threaded up over guide wires
Okay.
and catheters using X-rays and contrast medium injections.
Okay.
And the holes and that these are passed through are the size of your a ballpoint pen.
Right, that's what you were saying. I
Yeah.
mean, it's amazing to see that this starts out as a ballpoint pen and then it can expand so
That's right.
much.
Yeah. So these are compressed down onto a ballpoint pen diameter,
Okay.
long devices passed over guide wires, and then you're carefully opened up
Right.
into the exact position below these kidney arteries.
Okay.
And as a tidbit moving forward, today we have the abilities to place stents above these kidney arteries also. And a lot of the community here have heard of what we call fenestrated aortic aneurysm repairs.
Okay.
And that's been in the news recently. And I was actually the first in Southern California to place a fenestrated stent graft.
Oh, wow.
Yeah.
Wow. It's just amazing. I mean, technology today is really progressing. Do you see some new technologies coming out to help with this?
So this fenestrated stent graft, we placed our first fenestrated stent graft to treat aneurysms that are involving the kidney arteries.
Okay.
So the goals of these stents is that there's a small zone below the kidney arteries in which this graft sits by friction and seals.
Okay.
If the aneurysm is up to or involving the kidney arteries, there's no zone here to seal.
Okay.
So the stent actually needs to be placed higher up. Well, what
Okay.
happens then is that how is the kidneys going to get blood flow?
Right.
And that's going to require little custom cutouts, or what we call fenestrations in these stent grafts.
All right.
And these fenestrations are now commercially available on these type of stent grafts, in which we are now treating a broader range of aneurysms that traditionally previously weren't able to be managed with these
Okay.
with the infrarenal devices.
Wow, that's great. That is great. What are some things people can do to prevent having this happen to them? Is there anything in particular?
Well, the main thing would be smoking, and that's the
Right.
thing that we can always counsel patients towards. Hey, look, you should stop smoking. And if they've ever had, and that's a good time to also identify their history of smoking, to say, hey, look, if you've ever smoked, that does put you at a higher risk than the general population. So those are the things that we typically talk with patients all the time. The other general risk factors that we talk with patients is high cholesterol. Some of the diabetes can also contribute to hardening of the arteries throughout the
Right.
body. So these are the things that we always touch on with our patients and make sure that they're aware, because
Right.
we're not going to know anything if they don't tell us.
Right. Now, when you mentioned smoking, I mean, now obviously there's different kinds of smoking that are going on these days. I mean, are you talking about historical smoking from cigarettes, cigars? What kind of smoking does
It would
contribute?
be cigars, nicotine, cigarettes.
Okay.
These days with the other forms, there hasn't been association directly with those
As of
things,
yet,
but
okay. Okay.
at least for us, typically,
I
yeah.
suppose time will tell, right?
Yeah.
We'll see. All
Time
right.
will tell.
Time will tell. Okay, well, excellent. So if anyone wants to know more about this, they can always go to the memorialcare.org /SB Heart. And thank you both for being on. I appreciate it.
Thank you, Lisa, for having
Thank
us.
you.
All right. And we'll be right back after this. Thank you both.